Before beginning the session, we will have a silent prayer. So welcome everyone for today's session. Today's our guest is Dr. SHWETA Singh, MD in homeopathy, and she's a PhD scholar. She's working as a senior research fellow in Central Council of Research, Homeopathy Headquarters in New Delhi. And she graduated from Baxham Homeopathic Medical College and got MD from Sri Guru Nanak Dev Homeopathic Medical College, postgraduate diploma in health promotion, and now doing PhD. And she is the first female president of Delhi Homeopathic Association and chief administrator of KHA Homeopathy for study group in USA, and chief editor of biannual newsletter, executive editor of Hanuman's Homeopathic Sandesh, and associate editor of Homeopathic Heritage, and worked as a medical officer in Muskan Foundation in the field of drug de-addiction, and worked as an assistant professor in many reputed colleges. Recently, she has awarded with the legendary homeopathic award from Health Minister of Uttarakhand. You are welcome, Dr. SHWETA. We are so happy to have here in our session. Welcome to IFPH Forum. Thank you so much.
I was unable to unmute. Now it's fine. Let me share. Thank you, Dr. Anjani, for this beautiful introduction. And I would also like to thank Dr. M. Kisani, sir, Dr. Danesh, and the team members of IFPH for giving me this opportunity to share my little clinical knowledge in at your platform. So I hope my slides are visible.
Yeah, substance use disorder and homeopathy. It's visible.
So nowadays, we all know that psychoactive substance use is very common in the society, and we are struggling with these kind of psychotropic psychoactive substances like alcohol, cannabis, opioids, inhalants, etc. We should know what are these substances, how they act, what is the effect, and what is the impact of these substances, these drugs on the society. We call them with different names like drugs, narcotics, psychotropic. When we use it legally, then they are known as psychotropic drugs. Then they can be called addictive drugs when they develop addiction. You can also call them like recreational drug, because when they are used for recreational purposes, like for intoxications, like we use sleeping pills, we use painkillers, and they are also known as therapeutic or paraceutic drugs, which have medical indications. But the correct term which we use is psychoactive substances. So basically, what is substance? What is a drug? It is basically a chemical which affects brain when consumed. Psychoactive substance use disorder is defined as chronic, relapsing, and brain disorder. It is a disease. It is not a behavioral problem only, but it is a chronic, relapsing brain disease. Then we should know what are their effect. We have already covered what it means. Then what are their effect and what is its impact on the society. Now the effects. Basically, these psychotropic substances, they alter brain functions. They affect consciousness. They impair perception. They impair mood. They affect the thinking process of an individual when consumed. They affect the thoughts. They affect the logical thoughts, reasoning, or the linked thoughts. They basically impair the thinking process, and ultimately they alter the behavior of an individual or the motor functioning of that individual. The impact is not only on the individual who is consuming the drugs, but also on the family members, also on the society. And now it is important to know why drugs cause addiction and why people take drugs. Now, addiction is basically why they cause addiction, because they have the ability and propensity to cause addiction. They have that neurobiological effect on human brain, which affect the reward pathways. Whenever a person consume drug, it artificially stimulate the functioning of the brain and the reward pathway, which gives pleasure, which gives a good feeling to that individual, which creates happiness. And this pleasurable feeling basically motivates and cause reinforcement and promote the usage. And for this pleasurable feeling, we don't have to do any efforts. Usually, to get this kind of pleasurable feeling, to stimulate this reward pathway, we need efforts. But in this, the drugs basically produce this pleasurable feelings without efforts. So it promotes the drug usage behavior, drug taking behavior in an individual. And when the patient, they want to get this feeling again and again, so they start using it repeatedly, and ultimately it cause addiction. And why people take drugs? Basically to feel good, to try new experiences, sometimes to cope up with the negative pre-existing conditions or situations. Like if the patient was suffering from insomnia, they start taking sleeping pills regularly. If they have depression, anti-depression pills they want to take, anti-anxiety pills they will take. When the patients have lack of confidence, so they can take drugs to enhance their performances. Sometimes they use these kind of psychotropic addictive things under peer pressure. The adults between 15 to 25 years of age are more prone to such new experiments. They start taking drugs to fit into the social circles. Then there are some personality traits which are more prone to such drug taking behaviors, like the individuals who have poor coping skills, who are they have low frustration tolerance, so they start taking drugs to gain that confidence, to improve their coping skills, to control their frustrations, to fit into the society. And all these factors are basically the risk factors to get into such activities. Then other risk factors could be like easy availability of the drugs, or if the drug is more affordable, so they are usually uh, start taking these kind of drugs. Then the family environment is very important. If the person who is immediate family member, if they are taking drugs, so there are more chances that the children will get into such activities. If the parental supervision is inadequate, in such conditions the children are more prone to such activities, to get indulged into such activities. Or if the parent is single parent, then they are more prone to such get into such activities. There is various stage of addictions, like uh, at the initiation is from just for a new experiment. They start, they get that pleasurable feeling, then they start. The second stage is they start using it occasionally. Then the third stage is when they start using it regularly. They develop a pattern to use these kind of drugs, like they start taking it on weekends and all. There is a pattern involved. In the fourth stage, they need it daily. Then there is one more stage, that is the stage of dependence, when they need the drug to control the withdrawal symptoms, which appear when they stop taking drugs. So now they start taking drugs to just control those withdrawal syndromes, which is very much disturbing. So the cycle may be involved and it causes addiction in such patients. Now, the prevalence of substance use in Indian population between the age group 10 to 75 years of age. This is a survey which is carried out by the Ministry of Social Justice and Empowerment. And they found that the alcohol use in the 16 crore population is 14.6% of the population, total population uses alcohol uses alcohol. Now we have to differentiate what is use, what is harmful use, and what is dependence. Use is basically it is not a diagnostic entity. When we use drugs in occasionally without any negative consequences, it comes under the category of usage. So 14.6% of population uses alcohol, 2.8% of population uses cannabis, and 2.1% of the population use opioids. Then sedatives 1.08%, cocaine 0.10%, inhalants 0.7%, amphetamine type stimulants 0.18%, hallucinogens 0.12%. So this is the this is the chart which shows the alcohol or other substance use in the population of India. But if we talk about the harmful use, where if we use that drug substance, it produce physical, psychological effects when the use is continued for a long time. So basically, patient develop a pattern of usage. Despite he knows that there is the drugs are causing health damage, but the individual continue using the drug. This is a stage of harmful usage. And 5.2% of the population are in the harmful use category. 0.66% are of cannabis harmful use is there, and 0.7 opioid harmful use is there. Inhalants 0.21%. But this harmful use stage is reversible. In that stage, we can rehabilitate the patient. Then the next stage is this abuse, this dependence, where there is cluster of physical, psychological, behavioral symptoms with the other sectors which are also affected. Like there is occupational hazard, there will be social hazard, there will be legal hazard. And the patient is not stopping the usage of drugs. He is now dependent. This dependence is 2.7% for alcohol in Indian population, 0.25% of cannabis, and 0.26% of opioids, and 0.08% of inhalants. Now, if we want to define this substance use disorder, this dependence, so it is defined as the pathological problematic pattern of substance use and behaviors leading to clinically significant impairment or distress occurring within 12 months of use. as manifested by at least 2 of the 11 criteria classified under 4 domains. This is according to the DSM-5. Now, these 4 domains are impaired control, social impairment, risky use, and pharmacological criteria. Basically, substance use disorder, there is cluster of physical, psychological, and behavioral signs and symptoms where the use of the drug is very much prolonged, and there should be repetition of the drugs. These are some features which define that your patient is now suffering with substance use disorder. There are 6 core features which define that the patient is now an addict. Number 1 is craving for the drug. That means the patient experience a strong desire for the substance. It can be alcohol, it can be cannabis or opioid or anything. There is persistent desire or unsuccessful efforts to cut down the or control the use of that drug. So the patient craves for that drug. Second thing is prioritizing use of that drug. The patient is spent a lot of time in the activities to obtain and to use substance or recover from its effect. They they fail to fulfill the major role obligations at school, home, office. They basically prioritize the drug. They can do anything to get that drug. They leave all the works. They basically the social or interpersonal relationship, they doesn't matter to that individual. They just prioritize the drug. They get into such activities to just get those drugs. Then the third is tolerance. There is a need to increase the amount of drug to get desired effects. Then the withdrawals. Basically, there is a development of some unpleasurable signs and symptoms when they stop using drugs. So they get into that withdrawal syndrome, which is very important. And this is the stage where homeopathic treatment is very much needed if you want to manage that person, if you want that there is some long-term sustenance. So this stage is very crucial and it has to be managed well. We will discuss it later. Then the next core feature is loss of control. The patient basically loses control over her activity. They basically just try to, if they want to try, if they want to stop using drugs, they won't able to do that, because now the body loses its control. Their brain is not functioning well now. Now, next is ways of consumption. Now for the drug, they start threatening the family members. They start stealing different things to get money so that they can purchase that drugs. They become quarrelsome. They harm themselves, or they can harm other family members if they stop them using those drugs. So these are the ways of consumption. These are the 6 core features which we have to identify to diagnose that the patient is an addict now. Now the withdrawal syndrome. It is a cluster of clinical syndrome symptoms which develops after abrupt cessation of substance use that has been heavy and prolonged, which could be daily or almost daily use for at least a few months. These are the symptoms of withdrawal syndrome. There are signs and symptoms which produce after cessation, abrupt cessation of the drug use, which was prolonged and repetitive. In alcohol, you can find anxiety, restlessness, tremors, insomnia, vivid dreams, loss of appetite, nausea, vomiting. There could be marked autonomic hyperactivity, tachycardia can be there, hypertension can be there, fever, sweating, tachypnea. There could be severely impaired sensorium, disorientation can be there, confusion can be there, psychomotor agitations you can find in such patients if they abruptly stop using alcohol use. Then illusions can be there and hallucinations can be there. It is important to know when the patient has taken the last dose to classify or to diagnose in which stage the patient is. Usually, these withdrawal symptoms begin in 6 to 12 hours of the last usage of the drug. In 12 to 24 hours, these symptoms reach to the peak and they usually persist for 3 to 7 days. Depending upon the quantity of the drug use, the type of drug use, and severity of the symptoms. So we have to manage the patient at this stage, because if we fail to manage these withdrawal syndrome, the patient will again get into addiction. When he take drug, these symptoms got relieved. That our patient usually know. So we need to just manage this stage and provide relief to the patient as soon as possible. Close observation is required at that time. Seizures can happen in 12 to 18 hours of the last dose taken. Hallucinations can occur in 12 to 24 hours of the last dose taken. And especially in the cases of alcohol, there is a stage there, delirium tremens, which occur in 3 to 4 days after the last dose taken, which is a medical emergency, and it is not possible to treat the patient in clinics at the time. We have to refer the patient if he is presenting in 3 to 4 days. If he is presenting with illusions, hallucinations, or seizures, he can go. It is a medical emergency condition. We have to refer those patients to hospitals. Now, this withdrawal management is the initial stage. Which is necessary. The management is very necessary for long sustenance, for long-term recovery. In cannabis patient, the withdrawal syndrome consists of the following features like irritability, anger, there is aggression, there is nervousness, anxiety, insomnia, decreased appetite, weight loss, restlessness, depressed mood, abdominal pain, shakiness is there, tremors were there, excessive sweating will be there, fever, chills, and headache could be there. In opioids, you can find pupillary dilatation, lacrimation, watery eyes will be there in opioids addiction. Rhinorrhea, running nose could be there. There is frequent yawning in opioids addiction. So with these symptoms, you can diagnose your patients. Stomach cramps, diarrhea, vomiting. In opioids patient, the pains, there is severe pains, severe body aches, muscle spasm will be there. It is severe in opioid patients. There is restlessness, anxiety, irritability, and insomnia. Anxiety, restlessness, irritability, aggression, insomnia, loss of appetite or diarrhea, vomiting, these are common in all these substance use. And tremors, you have to ask the patient to extend their arms, their upper limbs, and you can find there is presence of fine tremors, like you find in hypothyroidism or parkinsonism. So such fine tremors are also there in withdrawals. Now the treatment goal, the first initial stage is to help your patient to come out of these withdrawals in a safe and comfortable way. Second goal is to enhance the patient's motivation to achieve treatment, long-term treatment, and abstain from the substance. Here, the counseling is very important. We have to treat the day-to-day illness of the patient while he is in recovery, under recovery. Usually, these patients are malnourished, their immunity is very low. So, we have to treat everything at that time. In Aphorism 1, Dr. Hahnemann wrote that the physician's high and only mission is to restore the sick to health, to cure as it is termed. So we have to correct all the sectors where the patient is affected. We have to treat the physical, mental, social, and spiritual symptoms, signs, and symptoms which your patient is presenting. We have to basically rehabilitate the patient. We have the routine of such patients are very much disturbed, so we have to get our patient into the daily routine. We have to correct that routine. Now the next stage is detoxification. When we treat such withdrawal symptoms, signs and symptoms, this is known as withdrawal detoxification. The initial phase of treatment of substance dependence, which includes the treatment of withdrawal syndrome, which surfaces after abrupt cessation of substance, assessment of medical complication, with treatment of those requiring acute intervention, is known as detoxification. In this stage, we need acute remedies to treat our patient. Withdrawal syndrome is treated by the acute remedies as per Dr. Henneman. Homeopathy, basically in addiction, we usually treat the patients according to the signs and symptoms which the patient is presenting. But the challenge is the patient is almost always in denial state. They won't accept that they are addict. Usually the family members or the relatives of the patient who is an addict, they approach you. You won't find mostly you won't find any addict who approach you for his or her addiction. Or you can find a patient who is coming to you for some different issue, and in the past history you can see that he is really an addict, or if he is suffering from withdrawal syndrome, and if you are aware of the withdrawal signs and symptoms, you can diagnose that he might be taking such and such drug. So in homeopathy, we need that the portrait of disease, the picture of disease, we need the clear picture so that we can find out that simillimum which is helpful in that individual case. That totality of the symptoms is required. But here it is very challenging to get that totality, that picture, Because sometimes if the relatives or the family members are approaching you, it is difficult. They are usually very much anxious about their family member. They won't be able to give you that the pure picture which is required to treat those cases. But here we can help the patient, the family members, we can motivate the family members, we can counsel the family members to just uh, get that patient in our clinic so that we can counsel him, we can motivate him to start treatment, or we can make them aware regarding the rehabilitation center where they can get that help, and we can give the homeopathic treatment in such centers. Then the component of treatment, basically we require the integrative approach along with the homeopathic medicine which we give to our patient. Family assistance program is required. We need the recreational activities. We should give the patient psychosocial treatment. We should give the patient counseling. We can give the patient spiritual treatment. So every sphere is to be treated well to get that desired result, to rehabilitate such patients. There are different behavioral traits in such substance use disorders. Like these patients are very much abusive. They are backbiters. They are being greedy. They need money all the time to get those drugs. So they are being greedy. They betray people. They bickering. Basically, they are very, very much argumentative. Blaming. They blame others for their behaviors, for everything. Breaking the house rule. They are basically, they do not follow the house routine. Butting in, they are interruptive. In any conversation they can interrupt. They are hitting back. They are holding of guilt. Why we are discussing these behavioral traits? Because in homeopathy we are the ones who take mental symptoms along with the physicals and other pathological symptoms. We require such mental symptoms to treat the patient well, to for a holistic treatment. So mental symptoms are very important in such cases, or in any case, to get the simillimum, to get the results. So holding of guilt, we have a lot of remedies where feeling of guilt is there. So we can uproot that. We can treat the patient. If we know this, we can treat the patient holistically. They care a damn. They are very careless. They are very challenging to us. They always defend themselves. They're very defending, defying. They're very disorganized. They do not follow any house rules or their daily routine or anything. They give up easily. They are having their own way for everything. They are hindrance in treatment. Yes, they won't follow the treatment, the procedure, the process. They won't take the medicines timely. So they are hindrance in the treatment. Improper statements, justification. They have justification for everything. They are in the negative contact. They are very lazy. They don't want to do anything. They are very manipulative. There is negative filter down. When you try to make them, you want to counsel them, and if you say anything negative in that conversation, they will take the negative things only. They will focus on that. They will concentrate on the negative things only. So there is negative filter down. They are not following directions. They are procrastination is there, resentment is there, there is a feeling of anger, there is a feeling of insult in them. They are very irresponsible. There is lack of communication because of the that drug taking activity. They are they are not in contact with their family members. There is no communication with them. They are very offending, they are very reactive, they are sly, sleeky, they steal things to get those drugs. They're taking everything for granted, telling a lie. They are the liars. They are very stubborn, they are very obstinate, they are very threatening. They have that suicidal tendencies in them. If you don't give them the drug, they try to threaten you. They can harm themselves. They threaten you for so that you allow them to get those drugs. So these are the negative behavioral traits you can find in drugs, in these drug addicts. This is one case which I want to share, like of a drug addict that is presenting complaints. There was injury upper lip since 4 days, and there is apthe mouth. Palpitations were there, which increased in evening. The blood pressure was high, that is, the patient was hypertensive. 162 was the systolic pressure, and 88 was the diastolic pressure. The appetite of the patient was decreased. There is no desire to eat anything, and thirst was 2 to 3 liters per day, a little quantity at a time. Desire is for salty things, and the perspiration was scanty. The thermal reaction of the patient was hot. Tongue, it is white coated with bluish discoloration. As I told you that these patients are malnutritive, they are malnourished, sorry. So you can find deficiency of vitamin A, C, K, D, E. And mental generals were, he is very oriented and cooperative, he is calm in nature. There is in the family history, the father was alcoholic. Because of the family history which I got in this case, and there are syphilitic symptoms like palpitations, which aggravation was at night. So the prescription was based on those symptoms, and syphlinum 201 dose was given, followed by Rubramate 30 placebo, TDS for 1 week. Then on the next day, palpitation was much decreased, ulcers were same, but the appetite was also improved. And on examination, the blood pressure was little down. It was 150 by 90, and pulse rate was high, 110 by per minute. On the next day, the medicine was continued, Rubram met. Next day, there was mild headache, which ameliorated after sleep and aggravated in afternoon. On examination, the blood pressure was found to be controlled. It was 130 by 80 mmHg, and pulse rate was also controlled, that is 88 per minute. In the supportive measure, we have to manage the diet also of such addicts, because they're already malnourished. There are nutritional deficiencies because they don't take care of their routine as well as diet and everything. So we have to give them a healthy and nutritious diet along with the treatment. For the corrections of nutritional deficiencies, we have to make up for the deficiencies, and we have to give supplements to them. There you can find deficiencies of vitamin A, B, C, D, K, folic acid, bioflavonoids, iron, magnesium, potassium, cysteine, etc. So you have to correct those deficiencies with the supplements. Patients should be motivated to do regular exercises. You can engage them into yoga or dance therapy or any physical activities. You can ask them to go for a long walk for 40 minutes, half an hour. In the cases of alcoholics, you can ask the patient if they have the craving. You can allay them by eating a few raisins. An orange can be eaten before breakfast in the cases of alcohol, which can reduce or lessens their craving. So it is very effective in such cases. And you should, while treating your patient, you should provide a calm, well-lit, predictable, non-threatening environment to such addicts. There is a study which was carried out in Muskan Foundation, which I was working. It was a drug de-addiction center, rehabilitation center, which provides standard IPT care for substance use disorders. And it is a study where 100 patients were enrolled for that study. The inclusion criteria was male patients between the age of 18 to 15 years of age. All the diagnosed cases of substance use disorder as per the DSM-5 criteria were enrolled, and patient with regular substance use for at least 1 month. There is repeated use of drug bought by their family or the self-reported cases were enrolled, and written informed consent was also taken from the enrolled patients. Exclusion criteria, the pre-diagnosed cases, comorbid severe psychiatric illnesses like schizophrenia, as assessed by the consultant psychiatrist, they were excluded from this study. And cases with the medical emergencies, who are intoxicated, poisoning cases, or hypertensive encephalopathy, yeah, hyperkalemia patients, they were excluded from the study. The patients who have low GFR or raised total serum bilirubin levels or malignancy, they were excluded from this study. In those 100 patients, I found 47% patients were alcoholics, 8% patients were pure cannabis patients, 18% were opioids used, were suffering from opioid use disorder, and 27% uses multiple drugs. In the baseline socio-demographic characteristics, the mean age was found to be 35.88 plus minus 6.8 years. So around 30, in the 100 cases, the mainly age group was around 36 to 45, which was maximum they were admitted there. In the educational status, we can found that mostly patients who are addicts, who are under dependence, are graduate. And in the occupation, you can see 35% of the addicts were unemployed because of this drug use. 33% were in private job, and 35%, which is a good number, they are unemployed. Then marital status, if you can see, 62% were married, but 30% of the patient were unmarried. 5% were divorced because of this problem. In the family history, it was found that 32% of family members were taking tobacco or they are smokers. 16% of the family members were alcoholic of these addicts. In the nutritional status, you can see 52% patients of out of these 100%, 52% patients were malnourished. Blood pressure, 31% patients of these addicts were hypertension. So hypertensive. So hypertension is one of the complication of these drug usage, which should be treated. Most common symptoms which were found in such cases were anxiety, restlessness, anorexia, nausea, vomiting, headache. Sweating was also there. Tremors were there. Runny nose was there. Joint pains, body aches were there. Insomnia is 83%. GI upsets in 56%, goose flesh were there, yawning is there in 12% patient. The yawning, goose fleshes, these severe joint aches, body pains, runny nose, these are the symptoms, watery eyes, these are the symptoms of opioid addicts. The commonly used medicine in this study were arsenic album, Nux vomica, sulfur, pulsatilla, Rustox, belladonna. Other remedies which were also found to be effective were Merxol, Eupatorium perforatum, Lycopodium, Phosphorus, Natramure, Staphysagra, Ignitia, Acid Phos, Zincamet. Zincamet, basically, when you find tremors in legs, lower limbs, you can prescribe Zincamet, which is a wonderful remedy for addiction or for the tremors of lower limbs. Acid sulf, when there is internal trembling, the patient, basically tremors are present in these addicts, especially in the cases of alcoholics, you can find the tremors. So if the patient, when you examine, you cannot find external trembling, but the patient is complaining of that there are tremors. So it is internal trembling, and acid sulfuricum is a very good remedy for such internal trembling. Then antimcrude can be given. Grief is there, then you can think of ignitia, natramure. Such remedies can be helpful in such cases. If there is severe aches, body aches, you can give eupatorium perf, you can use belladonna, you can try bryonia, which can give wonderful results in such cases. But the symptoms should be on the basis of the totality of the symptoms. Every individual should get their own individual remedy after proper case taking, after considering the totality of the symptoms. Then after treatment, the results were, the mean scores of the outcome scales were compared at baseline, then on the 4th day, then at the end of first, second, third, and fourth week. This is basically a 1-month study for the withdrawals. Usually the withdrawals happen for 3 to 7 days. In 12 to 24 days, they are at peak. So 3 days के बाद 4th day पर we have compared the results, and we found that there is the decrease in the mean scores of the scale, and the result was found to be significant. You can see the chart. There is this decreasing trend of the mean values after the individualized homeopathic treatment. So this is all about my presentation. Thank you so much.
Thank you, Doctor. Thank you so much. And now we have 10 minutes to ask question to Dr. Shweta. The participants, if you have any question, means you can raise your hands and ask question. Abu Farhan, show thumbs up. Okay. Dr. Ram Parvesh Shah. If you have any queries, you can ask in the chat box even. You can directly ask also. Gracilia, we must add addiction to cyber games, causes alternation in social behavior. Gracilia, Dr. Gracilia, you are. Dr. Ram Parvesha, you can talk now, please.
Thank you, Dr. Andini. And congratulations, Dr. SHWETA Singh. Very good presentation, excellent session. Substances, substances use disorder, addiction, alcoholism, nice presentation and yes presentation, very presentation. Select remedies to Pelnam Doso, one dose, and Rugam Metal. Very, very thanks, Dr. SHWETA Singh. Thank you.
Thank you, sir.
Thank you, Dr. Ram Parvesh. Dr. Bob Lim. Gracefully, I think, after putting the question, she's.
That was a very brilliant presentation by Dr. SHWETA Singh. It covers almost everything that we can think of, and it has given us a deeper insight how we should handle cases like substance abuse. You know, it's very common nowadays among the teenagers and sometimes up to the adults. So I just quite impressed with your approach. I think it not only requires homeopathy, but a lot of interventions like social care and so many things involved. Is there any specific protocol which we can use homeopathic medicines, standard one to treat this type of substance abuses like cannabis and so on?
So basically, no specifics are there, but in the withdrawal state, we can give acute remedies like belladonna, aconite, and other remedies according to the symptomatology, as mentioned by Dr. Henneman in mental diseases. So acute state is to be treated with acute remedies, and after it subside, then we can go for constitutional treatment for long sustenance.
What about any detox remedies that we can use from
There are
homeopathy?
no specific remedies for detoxification. We have to go with symptomatology.
Okay, thank you very much.
Thank you, sir.
Thank you, Dr. Shweta, and thank you, Dr. Bob Lim. Dr. Danesh.
Yes. Dr. SHWETA Singh, it's really a very good session indeed. And it is quite relevant that the subject is very, very important nowadays, because we used to see a lot of people using all those things, and they may end up in Gunda's gang. This total destruction. So we will have to think of syphilitic remedies in those cases, and that is that's what you have demonstrated here, how beautifully homeopathy works in those situations. And whenever we get such cases, in the beginning, sometimes the person that may not tell the truth, but it is our duty to find the cause behind the illness. And sometimes some of these bystanders may spoke about this kind of things privately, because when they come with the patient, they may not be able to talk that this particular person is using this or that. And when they are not using, sometimes they may look like as a normal person, but soon after taking this thing, they may be an entirely different person. So there may be, they may show a dual characteristic, a dual personalities at times, and in those conditions also, homeopathy can do a lot of work. And
Definitely.
what's your opinion on this selection of syphilitic remedies for all these things?
Dr. Shweta.
Sorry, can you repeat, sir?
Actually, this is a syphilitic condition where destruction in its full bigger, and Some of them are maybe in acute stage, so we can say that some persons are in psoric and some are in other state, but most of them are syphilitic.
Yeah.
And
Right.
and
Yes,
what's your opinion on that?
Yes, sir, you're absolutely right. They are syphilitic because destructiveness is there in their mind. But we have to see what symptomatology they are showing at that time, at the time of what the acute illness is presenting at that time. Otherwise, we have many syphilitic remedies which could be of help. Like in the case which I showed up here, I use syphilinum on the basis of family history which the patient was presenting, the family history of alcohol in that case, and the symptoms are showing that aggravation night, ulcers were there, palpitations were there, which were presenting it as a syphilitic case. So we have to consider that. We have to consider the grief. We have to consider the past history, which is more important in such cases. So considering all the symptoms, then we should, proceed further.
Exactly.
yes.
Uh,
Very good answer, sir. Very good answer, Dr. SHWETA Singh.
Thank you.
Syphilitic, psoric nature, background of psoric nature, addiction and etc. And syphilitic nature, both. Thank you, very, very thank you.
Thank you so much.
I'm inviting Abdul Salam sir from Qatar to give vote of thanks to Dr. Shweta. Otherwise, Dr. Zubaida Salam, please. Dr. Zubaida Salam, please.
Not responding.
Okay, Dr. Mariama John, please give vote of thanks to Dr. Shweta, and then we'll go to Malayalam session.
Thank you, madam, for your nice presentation. On behalf of IFPH, I thank you. Please come again with another subject. Thank you, madam.
Thank you so much.
Thank you.
Thank you so much, Dr. Shweta, and I'm appreciating your courage to take such cases and giving inspiration to others for for taking this kind of cases. Thank you so much. Come again. So good. Bye. Thank you. Bye bye.
Thank
And
you.
we'll see the same time tomorrow. Now we are moving to Malayalam session. I'm inviting Dr. Mariama John for moderating Malayalam session.
हाँ, बोल, चल, खत्म।
Nandni, Ajni,